Broomfield. Unfortunately, oh, okay. I want to, you have a question? Yes.
Can you start a game without a med?
No.
Nope. No. Yeah, cannot start a game without a medic. And in the rule book, it states that if the medic is not there, and I'd have to refer to the rule book, but it's within a certain amount of time. If it's 10 or 15 minutes past, then that home team forfeits. Now, I'm glad you brought that question up. I'm really glad, because you know what? We all do this because we're passionate about what we do. I know you guys are passionate as coaches. I see it on the field, especially when you're running across the field chasing the referees. So, with that passion, you know, let's understand, this is youth experience. We're not high school, we're not at the collegiate level, we're not in the NFL. We don't have those resources. All right, so now I'm going to turn the mic over to Dr. Broomfield. I appreciate Dr. Broomfield coming out. Dr. Broomfield specializes, I know one of his specialties is sports medicine. I've met with him out on the field during the PAMS 7-on-7. I've had an opportunity to speak with him. In addition to his expertise and as a medical practitioner, he's also a provider for medic services in the event that we have chapter presidents here that need a medic. Now I know there are a couple of teams, because I received a couple of emails this week from chapter presidents inquiring about information on securing a medic. So with that, I want to turn the mic over to Dr. Broomfield.
Thank you so much. How you guys doing today? Good. I know some of the faces, so what I'm going to do is I'm going to spend the time to tell you a little bit about myself and who I am, and then what services we offer for you. Again, like Ron said, and thanks Ron and AAU for having me out. I am Dr. Aaron Brumfield, and I own Brumfield Sports and Family Wellness Center that's located in Westchester. I've been in private practice for about 17 years. In addition to that, I also teach at Southwest College. You can't hear me? How's that? There we go. So my boss is over there, my office manager, so I got a mic, so I don't really care if you guys can hear me or not. She got me, right? So, but I also teach at Southwest College. I teach anatomy, biology, and physiology, not because I have to, but because they need to see me. Just like these babies that you guys are coaching for, they need to see you as well. However, in seeing you, we want that to be a positive experience. And I so appreciate the young lady that was here before me talking about the injuries, because some of you coaches can be our worst enemies, straight up. Because it may be your star player that's gone down, it may be the Super Bowl. Honestly, I don't care. Whereas she probably won't do it, I'll take the helmet, because that baby is more important than your game, right? So I know you guys have all done the concussion training. Stand up if you've had the concussion training. I know, that's all. Okay, so now whoa, stay there. Now when is the deadline for concussions?
They're gonna have it done by game 1.
And game 1 is what day?
September 7th.
Okay, so September 7th. Now, no, don't sit. Now, those of you that are standing, those of you that are not standing, have you ever played any type of high school or little league sport? If so, stand up. Stand up. So, is anyone coaching that's never played a sport? Raise your hand so I can kind of see what we're dealing with. All right, now, that seems to be about everybody. So now, those of you that are standing, how many of you play football? Raise your hand. Good. All right, put your hands down. Basketball. How many of you play basketball? Okay. Oh, you all over the place, huh? Baseball? Dang. All right. So, with that, how many of you have experienced a concussion? Everybody else except for those that raise their hands, sit down for me, please. Everyone that has, if you haven't had a concussion, sit down, please. Those of you that have had a concussion, stand. Okay, so those of you that have had a concussion, right? Let me pick on you. What's your name? Willie? How many have you had? 3? You come over here. Anybody else? Can anybody be Willie? Because Willie just gave you the research that I came to give you. Go ahead and stand right here. How many? How many? Come on up here. So, has anyone been in a football game and saw a flashing light? Okay, hands down. Has anyone ever been in a football game and had a headache after a hit? Okay. Has anyone been in a football game and has thrown up after that? Has anyone been in a football game and became dizzy? Guess what? You guys have all experienced a concussion. Thank you. You guys have a seat. But you two, really? I wanted to make sure that I brought the most accurate research regarding concussions. We know the NFL is making a big deal about concussions, but that's at that level. But at our level, we're dealing with the same things. So as we saw from this gentleman, many of you, you guys played multiple sports. I'm 52. I don't mind telling you, 52 has never looked better, right? I'll pay you later. But 52, I don't mind telling you, when I was in high school, we played football and we ran track. There's a difference today. Your guys play football, they go to training, specialized training, and they go to 7-on-7. I have a question. When do they heal? When do they heal? They don't. And the reason they don't heal is because you guys, I guess they don't want to hear what I had to say.
No, I don't know why it does that.
Probably just so.
Because you got to do the power.
Yep, there we go. Test, mic check. All right. The reason they don't heal is because it's a syndrome called the overuse syndrome. They're using those muscles too much. And if you're like some of the parents that I deal with, you already have your kids lifting weights. What? The growth plates are not even closed yet. And what's happening is you don't even know you're stunting their growth. So let's get back to these two. So the research that I looked up that says in youth sports, if you've had 3 or more concussions, you're more prone to brain injury. Now, I know this gentleman, so he's a little off. I don't know him, but I'm sure some of you may validate as well, right? We don't want our kids being like these two. I'm just kidding. I'm just kidding. Thank you, guys. But in all seriousness, we have to protect those kids. And the one that knows that kid the best outside of their mom and dad is who? You guys. You know if they're a crybaby. You know if they got the dog in them. You know if they're a must play. You guys got must plays? You know if there's a must play, right? So when that kid goes down, the first thing I do as a clinician is I look to see how that kid is presenting. So for some of you that dealt with me for 7-on-7, and some of you got mad because the kid went down and I walked on the field, because research has shown me that if that kid is laying face down, I need to get there right away. But if that kid is sitting and he's crying and sobbing, I'm gonna take my time getting there, because by the time I get there, he's already up. And this held true. I was the team doctor for St. Bernard's High School for 4.5 years. I had all sports, I traveled with them and everything. And lo and behold, every time a player went down, by the time that I got there, my assistant got there, they were already up. So guess what? I started waiting and I started walking, unless they're face down. So what I need you guys to do when you have a kid that's down, look at the presentation. If they're face down, get there ASAP. Because face down is not a normal position in football, would you agree? And most often when you see somebody that's face down, it's a serious injury, right? So what we need to do is make sure that we're more diligent, and also supportive of these kids and their parents. The other thing, so let's go back to my chew that had 3 concussions. How long were you out? Did they take you out?
2 of them I
Wasn't diagnosed. Were you diagnosed? No, you said, no, you weren't. See, listen, I interview patients all day long, and I know there's certain words that when I hear an and I know they're lying to me, all right? So, first things first, don't rush them back to play. And then the other thing is these kids, you know, with their invention of something called YouTube, they know more about concussions than you do. So that assessment starts as soon as you start walking to them. Because if you go up like everybody else, hey, what's your name? Where you at? What's your mom's name? What are you doing today? Chances are they're gonna know those, right? So start assessing their behaviors because you guys know who is who and what their personality is long before you get there. And if you determine that that young man has to come off, let him come off. Because nothing is more important than football. Excuse me, nothing is more important. I know most of you would say, yes, that's true. Nothing is more important than that kid's life. Because remember, it's a game of life, not the game of football. Football only lasts how many years? And honestly, you guys are in AAU, right? You're not even in high school yet. So these kids who get to high school may not even want to play. So we have to make sure that we protect them all the way up. Because what you don't realize is they could be your future doctor. They could be your future nurse. They could be, you know, your police officer, your fireman, your bus driver. They could be somebody that you're going to need. And the worst thing that you want them to do is remember how you treated them. Quick story before I go. Taught at Southwest College. I teach a lot of nurses, intro to biology, they're starting out. And so a rule that I tell them is, I don't care where you are, if I ever come into a clinic and I see you, and I just have a knack for remembering everybody's grades, the first thing I'm gonna do is I'm gonna say, hi, how are you? And then can I have another nurse? As simple as that. So sure enough, I still live in the neighborhood. I walked into Kaiser on Dinker in Manchester. Anybody know where Kaiser, Dinker to Manchester is? Walked in, 2 of my students that went to my class together. They walked in, hey, Dr. Brumfield. I said, you already know the rule. Give me 2, right? Make sure you put something positive into each and every one of these boys. So I know my time is just about up. Are there any questions for me? Yes, sir. Come on up. I can't hear you. Come on up. I can't hear you. Come on, come on, come on, come on. If you're trained,
I can't teach, but I'm still not certified. Can I go on that time with the kids?
it's a matter of licensure because of liability. You have to have malpractice insurance. So now you may be able to assist someone, but you said hands-on, so that's a liability that would have to be covered with Ron and the board, right? So is that it? Anybody else? Any questions for me? Nope. All right, so look, thank you for your time. We offer, because forgot to do that.
Now, I have a quick question. So,
Who's talking to me? Yes, sir.
Normally, don't we have interns, right, that free of charge and be in position to be medics in games and things like that for people that really, it's an expense in the fields in itself. Isn't there some kind of groups that we can kind of lobby or look into to get that for our home fields?
There are some groups, but the key word that you use is interns.
Understood. But they're always supervised as well. Correct?
If there's a supervisor, you could probably do that. Absolutely right. Yeah, absolutely right.
Gotcha.
But an intern by themselves, no, not at all. Yeah. So Ron also wanted to let you guys know, so in the clinic we offer chiro, acupuncture, massage. We do have cryotherapy chamber, sauna. What am I missing? Lymphatic. They don't need lymphatic. Okay, well, I guess swelling, okay. But if you guys need some help, give us a call. You're probably going to speak to Jackie first, and then just tell her that you're from AAU, and then we'll do our best to help you guys out, right? So again, yes, sir. I think Jackie has some questions. You don't have them? Okay, I guess I got them. Okay. All right, but thank you guys so much. Hopefully I answered your questions. Thank you. Appreciate you.
I'll give it to you in just a second. I'll give it to you in just a second. I want to give you something.
I don't need that, brother.